Dr. Piskin, I would like to talk about sealants. When the sealants indicated, is it only for the first teeth, the baby teeth, or is it for the second teeth? And what about adults? Could and should they have sealants? Do they work? All that type of stuff. Tell us about sealants. Dental sealants, I guess.
Sealants are a great service. They're not expensive and they're easy to do. Sealants are pretty much used for adult teeth. They put sealants on the baby teeth so much. They don't really have such deep nooks and crannies, but the adult teeth, as soon as they erupt, the adult molars, they usually have a lot of fissures and grooves that everything can get stuck in when they chew food. So we like to seal that up and protect it, and it becomes like an ice skating ring. So if you're going to have an Oreo cookie for whatever, and you look on that molar, you're not going to see black stuck in all the grooves that when they go to brush, they can't get it out. It just sits there and ends up with tooth decay. So it's a preventative situation. Sealants, we do recommend it for any of the adult molars that come in that have any degree of any chance that they have nooks and crannies or deep grooves or fissures in those teeth. And it's very easy to do. And they last a good 3 to 5 years. It might take them through the stage where they might be very high cavity prone. But adults as well. The adults, just because they don't have a tooth decay on that tooth for 20 years, all of a sudden things can change. And they can become more susceptible. And we then might suggest sealing those teeth with sealants. So they're good for any age, and they're indicated for any molar or bicuspid it's usually the back teeth where things can get stuck and more susceptible to having tooth decay.
Oh, wonderful. So basically adults can have them doing it. It depends a little bit what you're saying on the actual tooth. If the tooth, is like a rock with lots of little grooves, then it's more likely that the tooth should maybe have a sealant, versus if it's a smooth surface tooth with none of that little grooves in it. And that depends on how the tooth is grown by itself, which is nobody has an influence over it, I guess, right?
That's right. If it's easily washed away and easily brushed, the surface of the tooth, because there's not many grooves or nooks and crannies, I call them, then the sealant is not recommended. But most of us have deep nooks and fissures, like you're saying, cracks in a rock. And the sealant then fills into those cracks, and it makes it more like an ice skating ring, like I said. So when you chew and brush, it makes it a lot easier to maintain that surface there.
Okay. Anything a patient who does have a sealant should be aware of like how he eats? Are there any handicaps, or like for normal everyday eating the way we do, there's no problem?
No. Once the sealant is done, it's very easily done. We shine a special light on the tooth. It cures it. It hardens it instantaneously. So there's no need for any injections or any anesthesia. It's very easy to do. And they can have no restrictions on eating. They can eat as soon as they want, as soon as it's done. And over time, they might wear a little bit. So they last quite a number of years, and it's a great service. And if it does, we can always reapply it or retouch up, and it's a great protective nature for preventing cavities.
Well, wonderful. I guess an ounce of prevention is worth a pound of cure, or something like that, right?
That's right. They thought of that for a reason.
Yep. Thank you very much, Dr. Piskin. Very informative.
You're welcome.